Hello and welcome to another episode of Understanding Boericke Between the Lines. For all those who have not seen it before, you can go back to the same YouTube channel and see the first episode of the very basics of how to understand Boericke Between the Lines. But this is one book that has changed a practice not only to me but to many thousands and lakhs of homeopaths around the world. The whole reason for this is there is something in between the lines that make a difference. Many of us have not understood it completely. The reason is we did not actually think the way he was thinking. But something after many years of understanding and practicing, we found that there is a thin strand of physiopathological connection. The understanding between the toxicity of the medicine and the connection between the human mind and the body, which has unraveled very wonderfully by the one and only Dr. Boericke. And it stands true for decades and centuries that we have been using this knowledge and making a difference to many lives. The series unfolds remedies to be understood in a larger spectrum than what we ever did. We have been using boric as a source of giving relief or curing many cases by using those most prominent symptoms of the materia medica. But have you ever understood how did he come to it? Have you understood that what he has written has a connection slightly deeper than just the factual symptoms? This thin strand, this understanding of the remedy, which can now be used in a larger spectrum with a larger perspective and unraveling the smallest secrets, has been possible to an extent by whatever we did in research for so many years. So today we begin another episode with another wonderful remedy and a case. So this is about this great man, Dr. William Boericke, who stayed on this earth from 25th October 1849 in Austria to 1st April 1929 till he breathed his last in San Francisco. This is one of the most celebrated books in the Materia Medica and the most widely opened books from the tables of the clinical practitioner of homeopathy. If you open the first preface, he writes, the book contains the well known verified characteristics symptoms of all our medicines, besides other less important symptoms aiding the selection of the curative remedy. All the new medicines and essentials of the published clinical experience of the school. He says it is a clinical experience. It is not a proving. It is not something that has come in somebody's dream and fantasy which has been written and open for application. It is something that has been verified in clinical practice. In the present compact, promise contain the maximum number of reliable materia medica facts, and this is most important, which helps us in our practice. It is most reliable materia medica facts which have been now clinically verified by lakhs of physicians around the world. And that is one reason that people in crisis and in their day-to-day practice always refer and trust this book, Boericke's Materia Medica. So let us understand Boericke's Materia Medica with some cases, because these are the cases which help us to retrospect each and every aspect and then see how true every line what he says is. This was a very simple case of sciatica. A 38-year-old lady comes with the chief complaints of left-sided sciatica since 2 months. Now, this pain was very agonizing. She had tried most of the modern medicine. She had tried taking injectables, but the pain won't get to normal. She could hardly walk. She had to lift her leg many a times, and standing was most difficult. She came to me in a very acute situation. That time, Since there was no other way just to see her acutely and prescribe, this is what we have understood. When I observed her, she had a pain radiating along the left leg with contraction of the hamstring muscles. She pointed out to her hamstring muscles as if she had a cramp there. Then she pointed out to her hips, the hamstrings, and the calves. This was peculiarly evident. Though it was a radiating pain, she pointed out the pain in spots. The modalities were very common. They were more on lifting, on first motion, better by warmth, better lying down, aggravated standing for a long time, and when she would rise up from the chair, she would get this excruciating pain. When we saw the x-ray, there was a loss of normal lordosis, there were osteophytic changes in the lumbar spine, and some degenerative changes with the age. Since it was a very acute emergency, we took a very clinical totality. Since the pain was left-sided, we took pain, left-sided sciatica pain. Okay. Since she pointed out peculiarly in spots, sciatica pains are generally radiating, but when they are pointed out in spots, that becomes a peculiarity. So pain in spots and pain lower limb lying ameliorates. These were the only three rubrics that were taken for an acute totality. On the repertorization chart, there was one remedy that caught my attention. If you see this, you have Ammon Muraticum, Daliscalibichromicum, Silicasis, and sulfur. These were predominantly left-sided remedies having been used very rampantly in sciatica pains. But one remedy that was pointing was Ammon Mur. When I read it from the Materia Medica, there is something very interesting that pointed out to me. The contraction of hamstring tendons, sciatica, worse sitting, better lying down. Now, this contraction of hamstring tendons, which is written, is in capitals. And he laid a huge stress on it when he writes in capital. And that's exactly what she was doing when she was holding the leg. She had held the hamstring muscles tightly and was pointing out that the pain is very intense here. So we decided to give her the remedy Ammon Mur 30, just a few doses, twice a day. We followed up after 2 weeks, and surprisingly the pain which was there for 2 months had reduced. She could walk better. The gait which was disturbed because of the pain had now improved considerably. Now, this made me understand the case in detail. Since the pain had subsided, due to a routine practice, we decided to take this case in detail. And that is where the whole revelation occurred to us. On detailed case taking, there was a situation. And the situation was such that this lady's 24-year-old son met with a sudden cardiac arrest and expired without medical attention. He just suddenly died. She goes to see him in his room, who had just come from work, and he was lying down completely cold, just dead. When she saw him for the first time, she was shocked with fright, and since then, her husband said that she was so sad and gloomy. She just couldn't help her mood any time. She was completely melancholic for a year and a half or so. She never recovered from that trauma. And this trauma was the one she was carrying for a long, long time. On inquiring about the grief further, her husband said she had become extremely sad. Constantly she thinks about her son's death. that must have happened. Why did he die? He did not have any problems. He was just sitting there. I go to the room to see him and he's not there. So this was a very important part since when the problem started. The case is very much in detail, but this was the most important part from which her pains had aggravated. So let us understand now this remedy Ammon Mur, which helped her, and that was something which revealed to us after understanding it this way. Now if you open Boericke and see the first generalities, they write all mucous membranes secretions are increased. So it talks about a physiology, that there is mucous secretions which get increased. Then he gives a essence of the constitution adapted to fat and sluggish people. Then he talks about cough associated with catarrhs and affection of the liver. This is something very interesting. This is something which has to be understood between the lines, and this is what will be revealed as we go ahead. When he talks about two systems occurring together, some association of the systems like cough and liver affection, that means there is a physiological connection. Then he writes a tendency to irregular circulation. Blood seems to be in constant turmoil and pulsations. Now, this is also something that you should now look for. What is that which is irregular circulation? What is the constant turmoil? Then he says many group of symptoms are accompanied by cough and there is profuse glary secretions. Something which was very interesting was, he says head and chest symptoms are worse in the morning. That's the reason you have this typical morning sneezings in Ammon Mur. He says abdominal complaints are worse in the afternoons, and the pain in the limbs and the skin and the febrile symptoms are worse in the evenings. So you have three different set of systems getting affected at different times is the peculiarity of this remedy. And there is a state of prostration that is followed with this. Now this we are going to use and understand and apply in our day-to-day practice. How to see this in your patients. For your understanding, the extracts from Boericke are mentioned in green and the understanding between the lines have been mentioned in black. Now, Boericke writes for a constitution, a state of prostration bordering on typhoid state adapted to fat and sluggish people. So, how will the patient be? These are people who will be something very similar to Calcireka, but they have thin legs and big buttocks. And another important thing is the offensive foot sweat, which is a peculiarity of another 3-4 remedies like sanicula, silesia, alumina, and graphitis. So now you can imagine how an Ammon Mur patient will be. This is something like this. A typical Ammon Mur constitution can be. The sphere of action, because the sphere of action is the most important part of the Materia Medica of many remedies and most of all the remedies. Because if you understand the sphere of action, if you understand the cause along with it, then you know the spectrum of the remedy, and that physiological similimum is the new normal that will help you to understand how cure take place in pathological conditions. So, on the mucous membrane, you have increased secretions. So, the cough will have profuse expectoration, the mouth will have profuse salivation, the leukorrhea is profuse, discharge corroding the lips, so you have increased secretions everywhere. The typical fat deposition is around the abdomen and the buttocks. On the GI tract, it causes congestion of the liver and it is also a well-known remedy for cancer of stomach. How to understand the cancer of stomach? Because in most of the cases, or Materia Medicas, they have just mentioned this remedy in cancer of stomach. But how to prescribe these still remains many a times a most perplexing question. On the muscles, there is shortening of the muscles. Then it is a very good remedy for neuralgia, and one of the neuralgias is sciatica or the tips, the fingertips. Again, in hemorrhages, especially in female menstrual problems. If you look at the mental state, this is something that you need to understand because we are used to take huge amount of mentals. And these mentals we get confused in. But if you see in Ammon Mur, he writes the most intense ones. He writes melancholy. There's a comma after that. Apprehensive. Like the internal grief. Desire to cry but cannot. And consequences of grief. So if you have to understand that what is the most important aspect is the grief. And everything that now descends from grief, that is the consequences of that. But what are the consequences? He writes first melancholy. He never says shock. He says melancholy. And there is a huge desire to cry and cannot cry. Then the next word he writes is apprehensive. So what are the possible consequences of grief? One is melancholy and apprehension. Let's understand this deeper. So this is how you have to know Ammon Mur. All complaints are the consequences of grief, which is expressed as melancholy or as apprehension and fear. So the most important question for the patient would be, what was your expression of the grief? We many a times take this rubric ailments from grief, which can be misleading. So understanding the expression of the grief becomes a turning point in your case taking. Was the patient melancholic? Was the patient scared? Or something else? Now, melancholy, apprehensive, like from internal grief, this is something which is very important and needs to be understood deeper. So, if you take the rubrics, grief cannot cry, pride grief after, sadness grief after, desire to cry but cannot cry, you have Ammon Mur coming up more stronger than the natrums, than the aurums, than the ignatias. And how frequently we have been using other remedies apart from Ammon Mur. One of the most under-prescribed remedy in grief, because we never understood the expression of grief, how it was expressed. So if a person is in grief and has fright or melancholy after grief, we have only two remedies. One is Ammon muriaticum and phosphorus. So now it becomes easy for you to differentiate. Not because you know that the patient has an ailment from grief, but patient has a reaction to grief. He became melancholic or he became scared. This will have two remedies, and now you can differentiate by your clinical knowledge between Ammon Mur and phosphorus. This is how the repertory shows. Fear, grief as from, you have two remedies, Ammon Mur and phosphorus. Let's understand grief, because this is one of the most common emotions that we encounter in clinical practice. If you have grief, delusions from, zincum is the remedy. Headache, grief after, you have series of remedies like aurum, calcarea, ignatia, natrum muriaticum, opium, acid phosphorus, pulse and staphysagrine. But if you have insanity, your most common remedies are missing. If there is insanity after grief, you have arsenic, belladonna, cocculus and platina. So for irritability after grief, you have calibrome and magnesium. For prostration after grief, you have ignatia. But emaciation after grief, you have petroleum. Now you can retrospect and see in your practice or maybe in younger days, how many times we have been abusing patients with the remedy ignitia without understanding the effects of the grief. So, this is the most important line about Ammon Mur that you need to understand. How did the patient express his grief? There is something very important, the people who did not cry. Now, what is melancholy? Melancholy is a state of sadness which has remained even after the grief has passed and got over for a long time. Patient wanted to cry but did not cry. He stayed in a continuous state of sadness. And those people who have stayed in this state of sadness, melancholy is the one which predominates. And this predomination makes the patient go into a state of Ammon Muriaticum. So you have grief, cannot cry, Ammon Mur, Gelsemium, Natrum Mur, and Nux vomica. You can then differentiate with the help of physical generals or some deeper mentals. So, if you have to conclude as a physician, we need to understand the effects of the grief and not conclude with ailments from grief and prescribe ignitia, which can be a blunder in many newcomers who prescribe with ailments from. Now, we were talking about cancer of stomach. And he writes only in 2 lines: thirst for lemonade, regurgitation of food, bitter water brash, gnawing in the stomach, epigastric pain immediately after eating, and cancer of stomach. How would you understand this? You just can't prescribe by reading this line, cancer of stomach. Let us understand. Thirst for lemonade and stomach symptoms, epigastric pain immediately after eating. This is the most important entry point, because the remedies for cancer of stomach with a desire for lemonade, we have only 2 remedies, lachesis and belladonna. So your search gets narrowed. But the most important indication before that is the miasmatic background. It is the miasmatic background that decides that the Ammon Mur patient will suffer from neuralgia, gastralgia, or cancer. If there is a strong miasmatic syphilitic background, then a small emotion can also lead to a cancer. If it is a lesser or a different background, it will lead to a different clinical condition. So understanding the miasmatic background becomes very important, not just understanding the symptoms. So the entry point in such cases can be a high desire for lemonade. The next entry point can be the offensive foot sweat, which can be differentiated from alumina, graphitis, silicia, and sanicula. So, how would you now see a patient who has a problem on the GI tract, especially Ammon Mur? So, the patient may present initially with excessive thirst for lemonade, a bitter water brash. This can be more soric until proved with a miasmatic trait. Then the regurgitation of the food, pain immediately after eating. These are the most important indications. With the syphilitic background, when a patient develops prolonged grief due to a situation, that triggers the miasmatic trait to lead to CA stomach. I hope you understand this. This is the most important way to prescribe this. The miasmatic background triggers the trait within you. The prolonged grief adds fuel to fire, and the ones which we mentioned above become the entry point to make this remedy the individualistic remedy for cancer of stomach in patients, especially who need Ammon Mur. These symptoms, when found, you can have an entry point to Ammon Mur. So in GI conditions, the sphere of actions may include GERD to CA stomach. When associated with prolonged grief, may need Ammon Mur. Then you can see and verify with the profuse secretions and salivations, they are all the traits of the remedy. But this will be the most important entry point. Boericke writes, liver congestion and portal hypertension. That is the most important one which we always missed. The toxicity of ammonia. What is ammon muriaticum? It is a component of ammonia. And what happens when ammonia comes into our blood? The one which we have is hepatic encephalopathy. It is a condition that happens when liver is too diseased or damaged to properly process ammonia. So this symptom which Boericke takes is from the toxicity of the remedy and not from the proving. And that's the reason there is so much of vascular problems that happens with this remedy. So in this disorder, the ammonia builds up in the blood and travels to the brain. And that is where it can cause confusion, disorientation, and coma, and it can sometimes be fatal. This is the above confirmatory symptom that will also guide us to the remedy. And this is the physiopathological correlation, yet another understanding between the lines. So, when you talk about liver congestion and portal hypertension as one of the indications of Boericke, it is not the proving symptom, it is the toxicity of ammonia which has led to the liver congestion and portal hypertension. And this, again, when combined with the peculiars, the prolonged grief, they can help to reverse this condition. And this story needs to be understood between the lines when it speaks about the diagnosis, the action on the blood vessels, the grief, and then the most important symptom, the congestion of the liver and the portal hypertension. So, what is the course of illness? Because till today we were taking only symptoms, the totality of symptoms, and coming to the remedy. Now, taking the totality of the symptoms and coming to the remedy is one of the ways of coming to the remedy. But in pathological cases, which generally start with simple inflammation, then lead to a pathology, has a physiological journey, and every remedy has one. So when authors like Boericke speak about a pathology, they are also talking about the journey of the disease in a patient. So understanding this journey and tracing it in your patient becomes a most vital quest for every physician. And the day you trace this journey, you will be able to find something which I call as a physiopathological simillimum. And this physiopathological simillimum is now a new normal to understand the remedy. Symptoms come much later. Symptoms, they come after you are able to witness them. But the physiological change has already started. The first inflammation is silently growing in your body. And if you can listen to this voice of silence of the inflammation and trace its progress from the inflammation to the pathological expression, you will be able to prescribe the most unknown remedies as a remedy to reverse the pathology. And that is the key, because most of the symptoms which were written by our old masters were by the understanding of their toxicology. Their toxicological expressions were basically the symptoms. And if you can find this journey, then you will be able to cure most of the cases. So when I repertorized some of the very important symptoms of Ammon Mur, I found leukorrhea piles suppression from Ammon Mur is the remedy. Piles leukorrhea suppressed aggravates, or urine bloody pile suppression from, you have Naxomica. Now this two important things like the piles leukorrhea suppressed aggravates or leukorrhea pile suppression from Ammon Mur, what is this exactly? When you are having some kind of suppression of piles, why should a leukorrhea start? That means there is a physiological connection between the rectal vessels and the uterine secretion of leukorrhea. And this is something which is very unique of Boericke, and this is what we need to understand. So, abdominal complaints, he says that most of the complaints are associated with cough. And one of the most evident complaints in Ammon Mur is abdominal complaints with respiratory symptoms, or hemorrhoids after suppressed leukorrhea, or suppressed leukorrhea after hemorrhoids. If you can see this in your case taking, this will be the most important peculiarity of this remedy. That is what he is telling you, that most of the systems are having an association with cough. A patient will complain of GERD with respiratory symptoms, stomach complaints with asthma or congestion, or hemorrhoids with leukorrhea. Since this is one of the very frequently remedies which has been prescribed for sciatica, let us understand sciatica of Ammon Mur. Predominantly right-sided, but it is useful even in left-sided if the peculiars matched. It is localized in hamstring and posterior thighs. That is exactly where the patient points out. Contraction of hamstring muscles is one of the very important indication of Ammon Mur, and most importantly, pain in the spots. It is very rarely a Ammon Mur patient talks about a radiating pain. Most commonly, the patient speaks about pain in spots. Neuralgic pain in amputated limbs. In cases where the patients have had amputation, when you have neuralgic pains, it is one of the very good remedy. Many cases of demyelinating polyneuropathies where they have sensitivity of the tips of the fingers. This remedy has worked considerably well. So if I have to sum up now Ammon Mur, if you have to prescribe in your day-to-day practice, then the first important thing that every physician should know is how to enter. What is the entry point of this remedy? How will you understand that this patient is a case of Ammon muriaticum? The first and the most important is the grief which is expressed as fright or melancholy. Since the time this situation happened in my family, this patient is only scared. My brother is always scared after this situation. I have never seen him normal. He is now scared to take even the slightest thing. Or since the grief, this patient is always in a melancholic state, continuously in a kind of sadness where he is always brooding on that particular situation that happened. So this grief which is expressed in fright and sadness becomes the first entry point. Then sciatica with pain in the hamstrings or pain in the spots in sciatic conditions. Then gastric dyspepsia to cancer of stomach is a huge spectrum on which the remedy can act. You have to prescribe depending on the miasmatic background which expression the patient gives. Is it a psoric, psychotic, or a syphilitic expression? But all this will have one peculiarity, is the craving for lemonade. The moment you have a craving for lemonade with grief and you can see the miasmatic background, then you can treat the dyspepsia to the cancers. The obese constitutions with a peculiar heaviness, peculiar distended stomach and the buttocks. Then the neuralgic or the gastric or the hepatic or the vascular complaints, Ammon Mur has it all. These are the most important entry points. Now coming to the course of the journey. So many a times you will have a history of suppressed piles with respiratory complaints and liver complaints, or leukorrhea, hemorrhoid suppressions from, and the offensive foot sweat. So in cases of liver disorders, where the patient was having recurrent cough added with a situation of grief, now is a state of confusion where the ammonium toxicity results in such cases also can be reversed with Ammon Muriaticum. Lot of females who have had hemorrhoids for a long time, had been operated, now comes up with leukorrhea with the added symptoms of the grief, of the craving for lemonade, the offensive foot sweat. Again, Ammon Muriaticum comes in the prescription. So, if we have to conclude Ammon Mur, and if we have to conclude the understanding of the remedies, Boericke is one book where the remedies have been written in such a way that you need to understand them between the lines and not by symptoms. They have which explained in a way which can add another dimension to your practice. When I understood Ammon Mur, I found that there are so many ways that I could have used Ammon Mur in my practice. They really add another dimension to the remedy. A dimension which is deeper, focusing on the physiological process. Boericke is not the collection of symptoms. It is a physiological journey that is written in a unique style. A unique individuality will come in front of you. It's not only the physical constitution, it's not the mental makeup, but the physiological simillimum, which is solid, which is reliable, which is very practical, pragmatic, unchangeable, and most importantly, evidence based. In homeopathy, we have been only many a times prescribing on obscure symptoms where they have not had a clinical evidence. But Boericke is one book which gives you solid, reliable, and evidence based symptoms, which makes homeopathy scientific, universal, and most importantly, reproducible. So, welcome to the new world of tracing and finding the simillimum by understanding Boericke between the lines. And we invite you to this journey as we unravel much more and many more remedies in this journey. For all those interested, you can watch us on our YouTube channel and follow us on any of these addresses. Thank you.